This short film introduces the use of complex information processing, including 3D simulation of blood flow, to assist in the diagnosis and treatment of heart valve disease. Throughout all specialties of medicine, clinicians must make choices on the best way forward for each patient, and they typically face many such decisions every day. Sometimes the decisions are straightforward. There's little doubt about the treatment necessary, and in such cases there's no need for decision support mechanisms to assist in the process.
In other cases, the difficult grey area between possible alternative treatments is larger, and the process of reaching a conclusion can be much more difficult. Whether to recommend an immediate, usually serious intervention, or perhaps instead to opt for watchful waiting can be a real dilemma. In the Eurovalve project, we set out to show how, in one particularly complex area, that of heart valve disease, the use of the latest techniques in information processing and simulation can help clinicians to reach their decisions.
In heart valve disease, the aortic and the mitral valve affecting blood flow to the systemic circulation can be impaired. Valvular heart disease has reached epidemic proportions over the last decades, affecting more than 10% of patients in their 70s. At our 3 clinics in Berlin, Sheffield and Eindhoven, we run into situations where decision-making can be challenging, and it is often difficult to determine when and how to intervene.
At the center of the Eurovalve decision support system is the assembly of as much patient information as possible, so that the clinician might make the best informed decision possible on the treatment that should be offered and on the timing of that treatment.
It may be that immediate intervention, perhaps replacement or repair of the damaged heart valve, is appropriate, as the severity of the patient's condition and prospects of their recovery makes the choice very obvious. In other cases, the choice may not be very clear and the risk of surgery not justified. A delay may be more appropriate, with medication given to alleviate symptoms, with a further assessment in 3 to 6 months' time.
Behind the scenes in Eurovalve, the Krakow Cyfronet DICE team and the Sheffield Data Group developed 3 sophisticated information systems to help the flow of data and enable the complex calculations needed to run large number of simulations. Firstly, here in Krakow, we constructed a highly secure communication mechanism to ensure that our data, even though already de-identified, would be available only to the Eurovalve project team. Secondly, we elaborated the model execution environment to automate the use of our powerful high-performance computer Prometheus along with the cloud resources, so that individual patient simulations could be run automatically with none of the complex setup usually required.
Finally, we provide the clinical teams with the tools needed to capture the patient data required for analysis. For this, we use a system developed within Sheffield Teaching Hospitals, already designed for use by clinicians, but specially adapted to meet the exact needs of this clinical specialty. The system also incorporates powerful tools to query and analyze the captured data.
There are 5 components involved in the Eurovalve clinical support system, and we have developed a sophisticated software tool, an extension of an existing clinical product from my company Torva in France, and already in widespread clinical use, to bring the information to clinicians in a format they should find effective.
As with many complex medical conditions, there are routinely updated clinical guidelines agreed by consensus amongst medical experts worldwide that lay out a decision tree. Eurovalve has automated the presentation of this information directly from the clinical record, and it gives a broad assessment of severity and possible intervention. The second source of information is another mechanism agreed by experts that allows clinicians to understand the risks associated with an intervention. Eurovalve automatically calculates the results of the 3 most common risk scoring systems and presents the results clearly.
The third contribution of information of potential benefit to the clinician comes from an agreed database of previous cases. which is automatically searched to identify a small number of patients who most closely resemble the patient being assessed. This enables the clinician to explore the decisions made in these previous cases and to consider the outcomes, taking into account the degree of similarity.
The fourth mechanism included in EuroValve is new to clinical assessment and as yet is unvalidated, but it is arousing significant interest among medical professionals. Prior to any decision, the patient is monitored for a few days by wearing a device that records their activity. The results from this are proven to be an excellent guide both to the patient's illness severity and to their suitability for treatment, and it seems likely that after further studies this could enter routine practice.
The final approach to providing decision support is the most complex. Simulation is the latest addition to the clinical toolbox, and it provides information that is otherwise not available to us. By constructing a 3D mathematical model in significant anatomical detail without any physical involvement of the patient beyond routine imaging, we can obtain answers about the patient's condition before and after treatment that characterize their disease state and their expected benefit.
Our simulation system provides clinicians with information they simply cannot obtain in any other way. It seeks to answer two key questions at the center of decision making. Question 1. How sick is the patient? Normally, patients cannot perform strenuous exercise, an important indicator of their potential for recovery. But with a personalized model, this can now be calculated, and we have established a 3-point protocol for doing this. Question 2. How well will they recover? Typically, the intervention being considered is a replacement heart valve, but not all patients achieve the degree of improvement expected. With our further 4-point protocol, we can now predict this benefit and compare it with the risk of valve surgery. EuroValve automatically calculates these measures and presents them to the clinician in summary and in detail if required.
An important operational factor is the speed of computation. Thanks to a novel mathematical approach from EuroValve partner ANSYS, we are now able to use our supercomputer to pre-compute a very large matrix of solutions. This means that in a clinical setting, the results for any particular patient are instantly available. This innovation alone is set to increase significantly the use of simulation in healthcare, and the name of that innovation is Healthcare Digital Twin.
We have now applied the decision support system to the data describing 120 patient cases with extremely encouraging results. We have also evaluated the reality of using such a system by exposing it to a large number of clinicians examining real historical cases. Without exception, they have indicated enthusiasm for the further development of the system through to commercial availability.
So we've seen that EuroValve can support clinical decision-making by complex information processing.
The EuroValve team are continuing to take this work forward with the expectation that it will be used in the clinic before too long.